Imagine walking into work on only a few hours of sleep from a late shift the night before. Exhaustion pulls your eyelids down, but the patient waiting on the other side of the door forces them back up and puts a friendly smile on your face. You sanitize your hands, but the fear of infection still lingers in the back of your mind. You must avoid tripping in the cluttered OR as you make your way to the patient, ignoring the various alarms and monitoring gadgets that insist on making your head pound. As you reach to administer a drug to your patient, the thought of taking one to dissipate your stress quickly flashes across your mind. The life of an anesthesiologist comes with a price. The job creates a stressful work environment, causing burnout to prevail as an issue among its physicians, and requires immediate attention from those who regulate this environment. Burnout is a state of emotional, physical, and mental exhaustion brought about by an overwhelming amount of stress. In anesthesiology, occupational hazards and legal risks create the stressful work environment that induces burnout. Occupational hazards include biological, physical, and chemical hazards, as well as fatigue. According to Dr. Bawa, there existed high exposure to diseases such as tuberculosis, swine flu, immunodeficiency syndrome, and hepatitis. These diseases can be airborne or bloodborne, and it takes a lot of work to avoid them. Physical hazards include noise pollution and radiation exposure. Professor Volquin notes that the noise level in the OR can reach to over 100 decibels. This noise comes from air conditioning and medical equipment, which is then amplified by the structure and wall of the OR. Noise pollution is connected to a difficulty concentrating and a decrease in work quality. There also exists a high radiation exposure, which can negatively affect the entire body and can cause cataracts or even cancer. Chemical hazards include toxic pollutants and gases, as well as fires and explosions. Anesthesiologists face an exposure to toxic fumes, vapors, and gases. According to Bawa, inhaling these fumes damages the skin and eyes and can cause central nervous system toxicity. They also increase susceptibility to hepatitis, headaches, nausea, and fatigue. In addition, there exists a high likelihood of fires and explosions due to the oxygen-rich atmosphere and presence of inflammable substances and ignition sources. Fatigue is another type of occupational hazards that exists often in the field of anesthesiology. Long work hours don't allow anesthesiologists to get a full 8 hours of sleep, which over time causes sleep debt. Sinha, a professor at Drexel University College of Medicine, explains how the fatigue ensues impaired judgment and poor communication, increasing the likelihood of malpractice. Dr. Joseph Maroon, a specialist from the Department of Neurological Surgery at the University of Pittsburgh, mentions how more than 50% of physicians have been sued for medical malpractice, and 99% of those in high-risk specialties, including anesthesiology, have been sued by the age of 65. The process of getting sued had a major effect on them, and many report that it was the most stressful occurrence of their lives, inducing the loss of confidence, social embarrassment, and medical malpractice stress syndrome, which is the emotional reaction to getting sued and often encompasses shame and guilt. According to Dr. Tesler, malpractice claims increase with age, which is contrary to the popular belief that an increase in practice would eliminate errors. In fact, anesthesiologists aged 65 and older have 1.5 times the risk of being found responsible for litigation when compared to their younger colleagues. This proves that the field of anesthesiology has a deteriorating effect on its physicians. In addition, anesthesiologists are faced with ethical concerns. Anesthesia can be administered for a variety of controversial reasons, including abortion and assisted suicide. Society tends to voice these opinions loudly, and judgment can take an emotional toll on anesthesiologists. They must prioritize the patient to avoid litigation and stress. The field of anesthesiology creates an environment in which fatigue flourishes, occupational hazards persist, and the fear of getting sued never disappears. This leads to burnout, which, according to Dr. Sanfilippo, has reached a prevalence of over 50% in the medical population. According to Jung, the author of Ergonomic Occupational Risks in Anesthesiology, burnout syndrome induces depressive symptoms that afflict a considerable number of anesthesiologists. This, combined with the easy accessibility to drugs such as opioids, creates a high rate of addiction and substance abuse in the field. In addition, according to Dr. Alexander, anesthesiologists experience an increased risk of death from suicide, drugs, and disease when compared to the general population. So what can be done to fix this? Well, there are a number of proposed solutions, including wellness interventions and fatigue management programs. Jung believes that he can better the workplace through the implementation of ergonomics. He thinks that human error is the source of many issues and wants to decrease this error by studying the daily tasks and behaviors of those in the profession. This can improve physical and mental well-being and will better the health of anesthesiologists. Fatigue management plans work around the fact that sleep debt could better the work performance. Those that govern the work environment for anesthesiologists must create laws to change the work hours and prevent sleep debt so that patient care is not compromised. CEOs should be inclined to take this step because it's their company's reputation on the line when a fatigued anesthesiologist performs poorly. Although burnout is a widely accepted concept, some believe that it does not exist or that it is not caused by factors that I have mentioned. For example, Jessica Stillman, a writer for Inc.com, quotes Yahoo CEO Marissa Maher when she voices her belief that burnout is not driven by factors such as long work hours and tough working conditions, but by resentment and the fear of missing out on family events. While these concerns are valid, there are larger, more imminent issues that induce burnout, especially in the field of anesthesiology. The implications of burnout include drug addiction and suicide, making its prevalence in anesthesiology an issue of paramount importance. Society needs to take action. Through the implementation of wellness interventions and fatigue management plans, the opportunity exists to provide anesthesiologists with a safe, stress-free workplace. Anesthesiologists do not deserve to endure the negative effects of burnout, and their quality of life, as well as the health of their patients, will increase through its elimination. Thanks for coming to my TED Talk.